This is Dr. Meyer, a physician in Sacramento. Today I'd like to talk to you about body mass index. We've recently talked about the 4 vital signs, and some people are using measurements of pain as another vital sign. But the height and the weight don't mean very much without looking at both. And the way to look at both the body weight and height is called the body mass index. This has come under some criticism recently because, but it has become very common, even though we see a lot of patients that aren't used to it yet. For instance, if a woman is, say, 60 inches tall and weighs 200 pounds, that puts her in a body mass index of 40. It's morbid obesity with huge increased risk in hypertension, diabetes, heart disease, and so on. But a person of a height of 65 inches, 200 pounds, puts them in a very low range of obesity. On the other hand, somebody 70 inches tall, 200 pounds, puts them in slightly overweight, but outside, not in the obesity range. And for a 6'3" basketball player, 200 pounds is just a normal weight. And so the one without the other doesn't mean a whole lot. And the 20 to 25 is the range for normal body mass index. 25 to 30 is considered overweight. And over 30 is where we call it obesity. 30 to 35 is stage 1 obesity, 35 to 40 stage 2, and over 40 is morbid obesity. And the first example I gave you would be morbid obesity over 40. People that criticize this plan says it doesn't work for risk factors for everything. A better risk factor would be measuring the waist versus the weight, and that works for, diabetes and hypertension. But the experts that have looked at all the different measurements have decided now that overall risk factors is related best to the measurement of the body mass index. So it's very important to have that number for you. You should have it every time you see a physician. And now that we have electronic medical records, every time I put in the height and the weight, the body mass index comes up automatically, and so it's right there on the same line with all the other vital signs. That's it for today, and be sure to subscribe to my channel. Please post any comments that you have below, and so until next time, take care.